Right, so we will continue with the paranasal sinuses, and they are air-filled cavities that are extensions of the respiratory part of the nasal cavity, and they will extend into the frontal sinus, ethmoidal air cells, the sphenoethmoidal sinus, and also the maxillary bone into the maxillary sinus. So they are 4 on each side, the ones that we have just mentioned. And well, in the case of the ethmoidal air cells, these are like little cavities that are located in the lateral mass of the ethmoid bone, between the nasal cavity and the orbit. The functions of the paranasal sinuses, they are debated, and it's thought that they will help by humidifying the inspired air. They will help to reduce the weight of the skull, as they are spaces into the bones rather than a mass of bone. They will help to increase the resonance of voice, and as they are cavities lined with the pseudo-stratified ciliary epithelium containing the goblet cells, they will produce the mucus, and also as they have this cilia, they will move the mucus through the sinus and into the nose. They will have sensory supply from the ophthalmic and also the maxillary division of the trigeminal nerve. And the parasympathetic information is provided by, or parasympathetic supply is provided by the greater petrosal branch of the facial nerve via the pterygopalatine ganglion. So, as we said, all of these sinuses will drain into the nasal cavity. Now, how they will drain into the nasal cavity? We can see that the sphenoidal sinus will drain into this space here, and this is the sphenoethmoidal recess. Then into the superior meatus, we can see the openings of the posterior ethmoidal air cells. Then in the middle meatus, we will find these two structures. One is the semilunaris hiatus, which is this one, as it has a half moon shape, which is a semicircular groove where the frontal sinus, from superior to inferior, frontal sinus, then anterior ethmoidal air cells, and then the maxillary sinus will drain here. And also we find this ethmoidal bulla, which is an elevation located superior to this semilunaris hiatus, and where the middle ethmoidal air cells will open. So if we look from anterior to posterior, we have anterior ethmoidal air cells draining into the semilunaris hiatus, then the middle draining into the ethmoidal bulla, and finally the posterior draining into the superior meatus. And finally, in the inferior meatus, we have the opening of the nasolacrimal duct that comes from the lacrimal sac, and this one will open in the anterior aspect of the inferior meati. Now, we saw in the last lecture that the oral cavity consists of the oral vestibule that will communicate with the exterior, and also the oral cavity proper contained within the teeth. This is the space posterior and medially located to the superior and inferior arches. The roof will be formed by the palate, and the floor by the floor of the mouth, which is the mylohyoid muscle. And then we have the in the posterior opening there, we will find this structure, which is the pharynx. So the pharynx is like the superior part of the alimentary system posterior to the nasal, oral, and also the laryngeal cavities. And the pharynx, the extension will go from the base of the skull until the inferior border of the cricoid cartilage, and also the inferior border of C6 posteriorly. As the pharynx is related to three important cavities or organs, they will be related, or they will acquire different names. So, for example, the nasopharynx, this one, is located posterior to the nose and superior to the soft palate. It will extend from the base of the skull to the tip of the uvula and has a respiratory function. The oropharynx, located posterior to the oral cavity, and will go from the tip of the uvula until the tip of the epiglottis. This part will have a digestive function. And then we have the laryngopharynx, this one in purple, which is located posterior to the larynx, and it will extend from the superior border of the tip of the epiglottis until the inferior border of the cricoid cartilage here. And then it will be continuous with the esophagus. So the laryngopharynx will communicate inferiorly with the esophagus, but also with the larynx through this laryngeal inlet in the anterior wall. So remember how the oral cavity then is like communicated posteriorly, or when the bolus will come here, the epiglottis will close here posteriorly and will go over into the oropharynx and then laryngopharynx and then esophagus, whereas the air can come and then will pass here into the larynx and then trachea and then lungs. So this is how these two systems will cross. Now, the larynx is the organ that will produce the voice. This one is located in the anterior part of the neck, between the bodies of C3 to C6 vertebra. It will connect the pharynx with the trachea, and the functions will be phonation, so the mechanism of the voice production, and also will help to guard the air passages, principally when we swallow, as it serves for a valve of the lower respiratory tract. So it will help to keep patent